This is Sickle Cell Anemia by Trinity Woolman and Taylor Crispy. The disorder is caused by a mutation, the gene that controls hemoglobin, an iron-rich compound that lets red blood cells carry your oxygen to other places. With abnormal hemoglobin, red blood cells will be different and misshaped. Other names for sickle cell anemia are HbS disease and hemoglobin S disease. The gene affected by this disorder is hemoglobin. On the left is a normal red blood cell, and on the right is a sickle cell. There are prenatal tests for sickle cell anemia called amniocentesis. Some symptoms for sickle cell anemia are pain in joints, sudden pain in chest, dizziness, fatigue, and blood in urine. 70,000 to 100,000 people are affected in the U.S. Sickle cell anemia can only occur when both parents carry the sickle cell trait. Sickle cell anemia is inherited with two genes from both parents for sickle and hemoglobin. If they only inherit the gene from one parent, they will have a condition called sickle cell trait. Sickle cell anemia can be helped with antibiotics, pain-relieving medication, and hydroxyurea to reduce pain. Also, drinking lots of water and regular doctor visits help. Further assistance into adulthood is needed, but the adult treatment for sickle cell anemia isn't as great as the child care. The longer-term outlook for people with sickle cell anemia is a reduced lifespan, where most people used to die before 40. Now it's possible to live longer than that. Treatment will always be needed throughout the lifespan. There is no 100% cure, but bone marrow transplants can sometimes cure patients, but there are few donors. There are many treatment options, such as pain medications, to help. History of sickle cell anemia. Dr. Ernest saw in 1910 that red blood cells looked like sickles. It was a mystery disease for a while. In the 1940s/50s, the nature of the disease became clear to doctors and researchers. In 1951, Dr. Linus Pauling found that red oxygen-carrying hemoglobin had a different chemical structure in people affected by SCD. In the 1970s, better tests for the disease came out and more details about the disease itself. There are now new treatments, but a total cure has not been found. Carriers of sickle cell anemia. Sickle cell anemia can only be prevented if carriers of the disease don't have kids. Children are not advised to have, but a genetic counselor can let people know the risks of having a child. If a carrier of sickle cell anemia is a child with a non-carrier, the child will have sickle cell trait. If two carriers have a child, there's a 25% chance the child will be unaffected, and a 50% chance of having a child that's a carrier, and a 25% chance of having a kid with sickle cell anemia. And on the right, there's a picture that shows an unaffected carrier father and an unaffected carrier mother. They have 4 children, one unaffected, which is a 1 in 4 chance, and 2 unaffected carriers, which is a 2 in 4 chance, and then 1 affected child, which is also a 1 in 4 chance. Research sickle cell anemia. Research has found that bone marrow transplants can cure some people, but are rare and hard to find donors. Doctors work constantly to improve care all over the U.S. A treatment may be possible within our lifetimes. And on the right, there is a picture that shows red blood cells and sickle cells. The thinner cells are the sickle ones, and the full circular cells are the regular ones. Famous people with sickle cell anemia. Tyon T. Watkins, a singer, has sickle cell anemia. Prodigy, a rapper, also has disease. Tiki Barber, a pro football player, also has sickle cell anemia. And Miles Davis, a musician, also has sickle cell anemia. And on the right is a picture of Miles Davis.